Good morning. Morning. We'll start. Okay. See, we started with Silicea. Okay. I am quickly running through the PPT. Anyway, this is the last slide where I stopped. Okay. Now we will quickly look at what was discussed in the last class, and then we'll go ahead. So, what was told to you about Silicea in the previous class? I mean, we spoke of the common name, okay? We spoke of the source, preparation, prover and the habitat. Who proved Silicea? Dr. Hanneman. Good, okay. We'll look into the other area. The second objective we had was sphere of action. Where do you see Silicea acting? CNS, good. Periosteum, beautiful, good, agreed. Huh? Fibrous tissue, skin, kidneys, mucous membrane. What was that one word? No, what was that one keyword when we talk of Silicea? When we talk of, I know, circulation is also a keyword. We are talking about the sphere of action. Now, what was that one word I introduced in the last class? That Silicea is a polycrest remedy. So when I ask you where exactly Silicea acts, you know Silicea has multiple actions. Okay? And specifically when you are looking at Silicea, you see Silicea mainly acting on the skin, and then you also see Silicea acting on the CNS, kidneys, GI, very important. Respiratory, mucous membrane, almost all areas you see Silicea acting. And then we also spoke of ailments. What were the ailments? A quick recall, good, vaccination. Huh? Yeah. I mean, chest complaints in stone cutters, beautiful, good. Then foreign body, mental stress, good. Huh? What is it? Bullet. Okay. So yeah, it was told, but anyway, chest complaints in stone cutters. Okay, no problem. Examination fear, mental stress, physical stress, foreign body, vaccination, exposure to cold. Good, exposure to cold. Now we were looking at the physical appearance. How does Silicea look? Pot-bellied, good. How is the head? Large head. How are the fontanelles? Delay in ossification, very good. Delay in ossification, large head, pot-bellied, and extremities are, what is emaciated? Extremities are thin extremities. Okay? So that was the constitution, and then last part we spoke was mind. Mental symptoms of Silicea. We saw that they are shy, very timid, there's a lot of anxiety, anticipation. How will the child behave? Okay, no, I am talking of shy child, Silicea. I mean, you saw some pictures, no? Do not interact directly to the physician. So what will the child do? The child will whisper into the mother's ear. You ask some question, the child may not answer directly. He will tell it to the mother. Or if he has something to ask, he will not directly ask you. He will ask, or he will whisper in mother's ear. So very shy child, less courage. Okay. At the same time, we also saw that they are very mild, very yielding. Anything you ask, they can't say no. They give. At the same time, I also told you something very important. They are very stubborn. Mild yet obstinate. Okay. And a lot of fears. Quickly, what are all the fears of Silicea? Stage fear, good, agreed. Exam fear. Huh? Sharp things, beautiful, sharp things. What sharp things? We saw that specifically Silicea has fear of pins. And I use the word pin mania. A Viva question, a MCQ question. Pin mania. Name the remedy for pin mania. Okay, Silicea. Yeah. So now there is something, one of your friend also tried to tell that in homeopathy there is a remedy which is called as homeopathic surgeon, or it is commonly called as surgeon's knife. Now, which is that remedy? Okay, which is that remedy and why is it called surgeon's knife? We'll come to it, we'll come to it. Keep this in your background and you'll be seeing lot of incidences, okay, and we'll come in the end and we'll try to justify. You know, you have to justify, so focus on the class and this question will again come back in the end and we'll try to understand. So is this statement justified? We'll just try to understand, okay. Now for today's session, I have some objectives. This is important. What is it that you as a learner, you are going to understand? We stopped at the mind. You know, the mental symptoms, what was, I gave you last. So I'll be starting with characteristic symptoms and we'll look at few particular symptoms of Silicea and we will conclude with modalities. If time permits, we'll try to take up Silicea child. This will be an activity. You understand, you focus and we'll come back. So what is the first object you have here is, okay, anyway, this animation is not done anyway. We'll look at the thing here. Now what you see is, by now you have some basic information and what is that basic information? Silicea is a remedy acting on children. Okay. Now what you see here is, it produces defective nutrition, especially in children due to defective assimilation. Whatever food the Silicea patient is taking, from the knowledge of physiology, what will happen to that food? That food is digested, assimilated, absorbed and it will go to the different cells. Okay. Now unfortunately in Silicea, the assimilation is not happening properly. You are getting this point? So though the food is given, though the food is taken by a Silicea infant, Silicea child, that food is not getting absorbed. Okay. So in the bargain what is happening is, because the food is not absorbed, because the nutrients are not absorbed, the development is getting affected. You are getting the link? What is the link? What is the link? Due to improper assimilation, okay, there is slow development. Like for example, the physical body or the brain is not functioning very properly. So what you see in Silicea child is slow development in terms of slow learning to walk or slow learning to talk. So 1.5 years old or 1 year 3 months, Silicea child is yet to walk. Our child is almost 2 years. Child is not able to talk. Okay. When you have such patients in your clinic tomorrow, one remedy, you will be slowly told about many remedies. One remedy for time being could be Silicea. Okay. Slow development which mainly comes from imperfect assimilation. First point. Second thing is, when I was asking a question, what is the keyword in Silicea? Many of you came up with the right answer. But the question that I asked was in or under sphere of action. Okay. But when you are looking at Silicea, one word that reminds you about Silicea is its tendency to form pus. Pus formation. Wherever there is pus, meaning wherever means in the body, wherever there is pus, one remedy as a homeopath, one remedy that should come to your mind and that remedy is Silicea. So tendency for pus formation. So where do you see pus? In Silicea. You see, soft tissues, any abscesses, periosteum or small injuries they can separate. Yesterday I got hurt, and today morning there is pus formation. Bones, there was a fracture, I got injured. In bones you see pus getting formed. Okay? Or funsi, abscess. In the abscess you will have pus. So pus is something that you see, very prominently in a Silicea person. So suppuration, tendency for suppuration. We saw this under sphere of action. Tendency for pus formation. So first thing is the developmental delay. Now why is the developmental delay happening? Why is the developmental delay happening? Because the food what is taken is not absorbed. So when the food is not absorbed, for your body to grow you need nutrients. nutrients, no? So when there is no nutrients, how will the body grow? So assuming you give Silicea to this patient, so Silicea will help in absorption, and in turn this absorption is helping in development. This is the simple mechanism you need to understand. Okay? Any quick clarifications? All clear? Only two we have spoken. We'll go ahead, we'll look at the third characteristic symptom, which you know. Yes, acting on the GA, especially the lower GA, you saw Silicea causes constipation. Now what is the character of constipation? Now what do you understand by constipation? Hard stools. No issues. For a first year student, simple, hard stools is constipation. Good. Chalo. So constipation, and when do you see constipation in Silicea? Okay, so constipation before and during menses. This is the female genitalia, the female sexual organs, the ovaries and the uterus. So what I want to try to tell you is, a Silicea lady, okay, would have observed, Dr. Sir, 4 or 5 years, or 10 years, or since I attained menarche, I have observed something. Before or during menses, my bowels become very hard. Okay, this is only during that time. Otherwise, I am not constipated. Okay, so one remedy you need to remember is Silicea. See, each girl, each lady, before menses, during menses, after menses, they can have their own disturbances. So in Silicea, constipation before and during menses. Okay. Now, second very important thing we also saw is not only constipation, Silicea can also give rise to hemorrhoids, fistula. Okay. So there is something very characteristic. Fistula, and what do you see here? Chest. Very good. Chest. Good. You lock it there. Fistula alternates with chest complaints. Okay, I'll come to it a little later. Please focus on this thing. Fistula alternating with chest complaints. Okay. So when there is fistula, what? There will be no chest complaints. Okay. Or when there is chest complaints, there will be no fistula. So this is what we call it as alternating. When one is there, the other is not there. When the other is there, the previous thing will not be there. Alternating symptoms. Okay. Now, you didn't question me, sir, you told constipation. I put that slide purposely a little later, anticipating that there will be a question that is going to come up. Sir, you told constipation. How is this told in Silicea? Which is other remedy for constipation? Which is other remedy which is already discussed? Okay, Ruta. In Ruta you had constipation? What was there in Ruta? Frozen stools. And in Ruta what was the pathology? We have discussed Ruta. Ruta, what will it cause acting on the lower bowels? Very good, it will cause cancer. Okay. And one more remedy which had constipation was arnica. Arnica, we have discussed. Madam has beautifully explained you about arnica. What happens in arnica? Arnica, there is constipation. Look at the action of my hand. I told you, we discussed what is the character of stool in arnica. Okay, more than bloody. What is the character of stool? We have discussed. Okay, there is blood. Forget about blood. Other than blood. What will happen? What is the character of stool in arnica? Don't turn your pages. Popcorn. Okay, good, popcorn. But it is not arnica. And I told you, if we start describing stools with popcorn and other things, next time when you eat popcorn, you will be into a very awkward situation. So in arnica, at least it is not like popcorn. Okay, for time being you can still continue eating popcorn. There is a remedy which has stools like popcorn. We will discuss that a little later. Now we will come back to arnica. In arnica it was more like flat stools. Ribbon-like stool. It was stooled or no? Chalo, no issues. Ribbon-like stool, flat stool. Okay. Now why in arnica there is flat stool is a small assignment. You please have a look and let me know in the next class. I mean, I remember going through the same situation in some previous class. Did we not discuss arnica, having flat stools, ribbon-like stools? That's when I told popcorn stools. You remember popcorn and you forgot ribbon. Okay. Huh? So, in arnica it is ribbon-like stool. Now I want you to understand, in Silicea, these stools will be very dry, hard, knotty, partially expelled, recedes back, has to be removed mechanically. Please understand the seriousness. Okay. Now what is the seriousness here? Stools are dry, first part. Stools are hard, knotty, partly expelled and recedes back. What do you understand? It comes, it goes back. Huh? I know it's a wrong area. We are glorifying a wrong area, but as a homeopathic student you need to understand. Patients come and tell you the same way. Doctor साहब मेरे को प्रॉब्लम है. क्या प्रॉब्लम है? मोशंस का प्रॉब्लम है. चलो मोशंस में क्या प्रॉब्लम है? ये डॉक्टर साहब वो है ना. चलो बोलो बोलो क्या है? वो है ना डॉक्टर साहब देखो. आता डॉक्टर साहब लेकिन फिर चले जाता है. उसको आना था. It has to come out ना डॉक्टर साहब. It comes and फिर अंदर चले जाता है. Okay. So I mean we have situations like this, where stool comes and it goes back. Can somebody quickly interpret? I mean, Silicea. Where else you see this kind of a situation in Silicea? I know it's a very bad example. See, Silicea mind. How is the Silicea child? Very good. Can we apply the shyness here? Sir, no. Your friend is saying no. How can stools be shy? मतलब आ रहे वो देखो सही तो है चलो आ रहा है लेकिन पूरा नहीं आ रहा है चलो I mean कोई बात नहीं I mean see what you need to say I'm just saying you to I'm trying to explain and make you understand that see we get people like this in clinic and we'll go to the next part. So what will the patient do? ये डॉक्टर साहब आ रहा है लेकिन अंदर चले जा रहा है तो आप क्या कर रहे हो? डॉक्टर साहब 2-3 बार ट्राई करता हूँ साला फिर भी आ रहा है अंदर जा रहा है तो नेक्स्ट स्टेप में क्या करेंगे आप you meaning the patient don't take it too personal. The patient will use his fingers and they have to mechanically remove it. See how difficult the situation is. You getting my point? It is not coming out, it is very hard. आ रहा है अंदर जा रहा है fine, very hard, बाहर नहीं निकल रहा है. So what generally happens in Silicea is it has to be removed mechanically. I have patients. See, when I was a student like you a few years back, I was sitting and laughing. Aha, what my material medical teacher is telling. Stool आ रहा है जा रहा है and stool has to be removed mechanically. And we were all laughing. ऐसा भी हो सकता है क्या? But once you start practicing, you have patients coming. They might hesitate to tell. But if you give that comfort zone to them, तो क्या करेंगे आप? नहीं आ रहा है क्या करेंगे आप? आयो डॉक्टर साहब और क्या करना है? I literally use my fingers and I clear it. If you have somebody telling that is what we mean by stools have to be removed mechanically. Homeopathy has few remedies. As a first year student, you need to understand Silicea is one such remedy in which constipation stools have to be removed mechanically. Hope I am clear. Okay? So that's why it becomes characteristic. Okay? So 4 characteristic symptoms and we'll see what else Silicea has. See, Silicea is something very important. And this thing, sweating. Please focus, concentrate, very important. Sweating. See, each of us as individuals, we might sweat in different areas. I hope you agree. There are few people who will not sweat. Some are 400 meters running race, kuch nahi. Somebody 10 foot they put, they start sweating. They start sweating as if they have run a marathon. So what I also want you to understand is, this is individualization. This is homeopathy. Each individual is different. तो इधर पसीना कहाँ पे आता है? Silicea. Silicea, you know, from the ailments, you know, Silicea is a very, I mean, there is a lot of stress. He takes a lot of stress, he takes a lot of tension. So, when do we generally sweat? When, I mean, now I say, you have a surprise stress, take your papers. Okay, I am closing the PPT and start writing. Fine, then many of you might start, sir, what sir? And you know, it was so dry. Suddenly it starts, your sweat glands gets activated, and your kerchief, your friend's kerchief, dupatta, apron, everything we keep, we keep using. So sweating. So in Silicea, it is a very anticipatory remedy. There is a lot of emotional stress, so they start sweating. Now the question for you is, where do they sweat? Okay, where do they sweat? I put a picture here. The sweating will be in the soles. Naven Kannadalli angal antevalla. Sweating angalali irutte. Not only angalu, sweating is also there in the angai. Fine, palms. Palms and soles are the two areas where you see sweating. Sweating can be in the axilla. Possible. Sweating can be anywhere else. You also see in Silicea sweating over the scalp. Sweating over scalp, sweating over axilla, sweating over palms, sweating over soles. Sweating over soles. Now the next question. What is the next question? What is the next question? I told constipation. Then what did we do? We looked at the character of stool. Now what is the next question? Character of sweating. How is the sweating? So how will be the sweating? Yeah, one of your friends said, okay, very good. One of your friends said profuse. One of your other friends says offensive. Good. Any other character that you can think of? Color, very good. I don't know. Somebody, color, good. Stains. See, in Silicea, there is something very peculiar. And what is peculiar is, can you see this? Your point. Very offensive. Okay? And yeah, very offensive, especially the soles. So, you know, the Silicea socks, they are put in the wash area with other clothes. What are the other soiled clothes doing? They are removing the socks and throwing. Boss, you are too stinky. You are smelling too much. We don't want you in our laundry bag. They are throwing you away. It's only an example. So what you need to understand is, no laundry bag throws the fellow clothes. They have some respect for each other. They don't throw it like that. But in Silicea, the sweating, mainly palm soles, especially soles, very offensive. Okay? Not only offensive, see the beauty here. See the beauty here. Can you see something? More than stains. What is it? Holes. Beautiful. I don't know. Somebody observed there is some issues with the image. But what you need to understand is, the socks in Silicea is eaten off. The Silicea patient will have holes in the socks. Holes could be because of many reasons. Okay? 2 years you don't change your socks, you will have multiple holes. Then don't give Silicea to him. Holes will not close. Or further socks we can't assure holes. What you need to understand here is, why holes occur in Silicea. Any quick inputs? Where do you see holes in Silicea? We were talking about offensive thing. You also should remember, the Silicea sweat is acrid. What is it? The Silicea sweat is acrid. That acrid sweat is eating off the socks. Any questions? If there are no questions, at least are you clear? What is it that we are looking at? The Silicea sweat. Sweat is profuse, offensive, acrid, that it eats off socks. Okay, so acrid the sweat will be. So this is the character of sweating, very important. And many of you, when I told the recap, you were talking about foreign bodies. Silicea can remove foreign bodies. I told you as small things. For example, a fish bone gets into the throat, not the entire thing. Nobody will eat the entire thing. Fine? For example, a small fish bone gets stuck. Or I told you a small sand particle, small wooden thing, small things when they enter. Generally, what did I tell you? We rush we rush to a doctor. I mean, who tries to remove it. If it is not possible, he will make a small cut and remove it. Now what will Silicea do in these cases? So Silicea promotes expulsion of foreign body from tissues. Fish bones, needles, bone splinters, small foreign bodies are expelled from the body. And how will Silicea do this? We discussed in the last class. It hastens separation. It increases pus formation. So you see foreign bodies getting expelled. Foreign bodies getting expelled. Okay? So perspiration and what is this? What is this? What is it? See, go with the image. Don't use too much of your intelligence. Child is very good. Yeah, your friend is acting. So child is like this. Mother is bringing something. Now, what is it I am trying to focus here is Silicea, child, will not like few things. Each of us as an individual, we have our own likes and our own dislikes. Somebody might like banana. Somebody, the moment we say banana, fine? And somebody in front of her, we can't eat banana. If somebody is enjoying, see the problem is somebody is enjoying banana and she is happily eating, and somebody who don't like, how can she eat that? Oh, she is starting nauseating and vomiting. So what we are trying to look at here is desires and aversions. Each of us, we have our own particular or a characteristic liking and a characteristic aversion. What will Silicea not like? Silicea child has issues with milk and beauty for us, and very problematic for the mother. Silicea will not like mother's milk. Silicea will not like mother's milk. Mother's milk means naturally breast milk. Fine? And a sensitive mother can take it to a different level. He will drink Nandini milk. He will drink heritage milk. He will drink cow's milk, buffalo milk, all that he is drinking. But when it comes to mother's milk, whack. And an emotional mother will feel very bad. What's sir? Mera beta, mera hi doodh nahi pira. Fine? So she might become very emotional, very sad. Fine? See, there are women, see, there are few practical mothers. Chalo, kisi ka to pira na. There are mothers. See, they are also different constitutions. Because she is a sensitive lady, she is feeling very sad. देखो अभी ये कैसा मेरे से इमोशनली कनेक्ट होगा, किसी और का पी रहा है उससे कनेक्ट हो जाएगा, मेरे से कैसे कनेक्ट होगा. She might have her own insecurities, she might have her own stress, her own tensions. But the take-home point for you today is Silicea child will not like mother's milk. Tomorrow in your clinic you have a situation like this where mother says, Doctor Sahab, mera doodh nahi pira, mera bacha. You can think of Silicea. Okay, we'll go ahead. We'll see what else. Silicea has an aversion to salt. Good. Silicea has an aversion to meat, red meat. And Silicea has an aversion to cooked food. Cooked food. चलेगा सर, कोई बात नहीं. मैं बोलता हूँ, your friends are worried. सर, फिर क्या खाएगा? बच्चा माँ का दूध नहीं पी रहा, नमक नहीं, चिकन नहीं, नॉनवेज नहीं कर रहा, मीट नहीं कर रहा, और जो भी आप पकाएंगे वो नहीं कर रहा, तो क्या खाएगा ये बच्चा? चलो तो क्या खाएगा? I mean, generally what you need to understand is these are all the aversions. They will not like it. Right? They will not like it. Many times, we have kids telling, I have to drink, मेरे को दूध पसंद नहीं, लेकिन मेरी माँ उधर गन पकड़ के खड़ी है, दूध पी नहीं तो जान दे. फाइन, चलो मेरा जान प्यारी है, मैं दूध पी लूँगा. So there are situations, children yield, children give in. Okay. So what you need to understand here is desires. Silicea's desires for eggs. Anda pasand hai unko. Okay. Ice cream is pasand. Oh. And Silicea generally likes cold things. generally likes cold things. Fridge में जो रखा है वो पीना, वो खाना. Chilled. They like chilled things. And what else? They also, okay. I mean, there's one more. It will come there. They like raw vegetables. आपने देखा कि उनको cook पसंद है. So what you also see in Silicea is they like raw things, raw vegetables, salads. Okay. Anyway, it will come next. So desires, aversions, and there's something very important in Silicea. Every time the child takes to the breast, meaning every time the child feeds, there will be bleeding from vagina. Okay, see, this is again a hormonal thing. As a first year physio student, please go back to your physiology books and just try to understand as an assignment why the mother bleeds every time the child feeds. Okay? So this is a characteristic symptom. Now I hope you understand why this is put under characteristic. हर माँ में ऐसा नहीं होता. Fine? Every mother will not bleed when she is feeding. But Silicea mother might bleed when she is feeding. Okay? So desires, aversions, what is this? It's a beautiful situation in Silicea where homeopathy can do wonders. What is that one more thing that should be running in the background in your mind? Why Silicea is called surgeon's knife? Good. So what is it that you see here? Simple. As a first year student, just look at the image. क्या है इसमें? कुछ है ना image में? क्या है? Okay, so this what you see is nipple. Breast है वो and nipple. Nipple कहाँ है? Nipple, very good. बस good अंदर है. मैं नहीं पूछूंगा कि कहाँ अंदर है. अंदर है. Good. चलो. We'll not look into it, but what you need to understand is there is something called as inverted nipple. Invert समझना? उल्टा. Good. चलो. जैसा आप समझे, लेकिन समझो बस. Inverted. So typically not ulta, but what you need to understand is the nipple which has to be out, that is, in. Especially in lactating mothers, it becomes a big problem. Okay? When you are posted to third year OBG classes, you will realize there is something called as inverted nipple. So what will happen here is, generally in, if you are looking at the other part, they generally use some suction thing and then they put and they try to bring back the nipple to its original position. It's a very painful thing. Silicea, if indicated, if given, without all that painful procedure, suction, giction and all that stuff, with our sweet homeopathic pills, we can make sure the nipple gets back to its original position. So somewhere I am hinting you in various examples that Silicea is justified to become surgeon's knife or homeopathic surgeon. Okay? So inverted nipple, especially in lactating mothers, and we saw that, what was that? They have desire for raw vegetables. Okay? Now, before we take the next objective, we'll try to understand how much you have understood. Okay? So a few quick questions. What is the character of stool in Silicea? Behind? Hard, nutty, dry. Okay. And it has to be removed mechanically. Bus. So again, the understanding here is, take home message is, materia medica is a subject that should not be by-hearted. Silicea, dry, hard. Please don't do this. This is a subject, every subject for that matter, this is one subject that you need to, understand and apply tomorrow in a practice. Aisa nahi padna. Dry, hard. Somebody comes, hello, how are you? Then you, dry will become soft. Silicea, soft. So this is a subject, which you have to, it's a beautiful subject. Right? And understand with passion. Fine? I'll tell you, it will take you places. Every symptom that is told, you have to understand correctly. Okay? So, we did this, and what is the character of sweating in Silicea? Offensive? offensive, acrid that it is eating of socks. Some author says so acrid it eats shoes. I didn't tell you. It also eats shoes. Socks only you are not able to digest. Allah, socks. Abhi hum log bole shoe. I mean, but you need to understand. You need to understand. Silicea sweat is so acrid कि ये socks खा जाएगा. And even shoe, there can be. See, eating of shoe means ऐसा नहीं कि पूरा shoe रात आप shoe डाले सुबह shoe गायब. ऐसा नहीं होगा. लेकिन what you see is you might be seeing some when you pour acid now. I mean, you're all physio students. When you pour acid, it is eaten off. बस इतना समझना. ये मत समझना ये 9 फुट का what is it number का shoe 8 नंबर का है. किसी का 7 है किसी का 10 है. चलो मेरे को नंबर से मतलब नहीं. But what I want you to understand is ऐसा नहीं कि ये सब चले जाएगा. But what you need to understand is the acridity. Degradation. Yeah, it is the leather gets corroded. The leather gets corroded. Okay, eaten off. Very important. And what symptom alternates with chest symptoms? Fistula. Okay. These are few things. Okay. Any quick questions in characteristic symptoms? Again, we'll try to revise in the end. All fine. All of you are with me. You're understanding this. Okay. Now we'll quickly look at what is this. What is it that I've tried to show you here? Go with the image. Simple. I've tried to show you the physical body. I've tried to show you a male body and a female body. Now what is it I'm trying to hint? What is that hint I'm trying to give you? What is the next thing that we are trying to discuss? Body. What are the symptoms pertaining to body? Particular symptoms. Okay? Fine? Particular symptoms. So what we are trying to do here is, we are trying to understand particular symptoms. Meaning, acting on head, what will Silicea do? Acting on the GI, respiratory, bones, male genitalia, female genitalia, what is Silicea doing? Or what is Silicea producing is what we call it as a particular symptom. We have done this under Ledam. Under Ledam, what were the particular symptoms we discussed? See, unless you read what is done, you'll get lost. We spoke of joints, no? We spoke of injuries. They were particular symptoms. Ruta, we spoke of rectum. Ruta, we spoke of abortions. Abortions in Ruta? Later months, good. 7th, 8th month, later months, not early months. Done? Okay, so Ruta. So that was a particular symptom pertaining to the female genitalia. So this is a very important point I am trying to explain. See, to understand a particular symptom, you should be thorough with few things. What are those few things? First thing is, you should know the sphere of action. Okay. For example, if this remedy is acting on the female genitalia, how did you get to know it is acting on female genitalia? From sphere of action. So sphere of action becomes very important. Okay. The second thing, what is very important is ailments term. What do you understand by ailments term? Causation. Good causation. Simple. Good causation. And third thing is characteristic symptoms. Okay. And fourth thing, knowledge of anatomy, because we are dealing with the body, and knowledge of physiology because we are also dealing with functions. As a first year student, knowledge of anatomy, physio, and of course the knowledge of the remedy will help you in cracking particular symptoms in a better way. So we'll just take an example and we'll try to understand. Okay. Is this slide clear? All of you? Boys? Behind? Clear? Okay. So we'll just try to understand what is the action of Silicea on head. We are going from anatomical order. We are going from head to toe. And I am not telling the entire head to toe. I am giving you what is important. So under head, what do you expect? Very good. Fontanelles? Delayed ossification of fontanelles. Good. From where did you get this symptom? We got this from physical appearance. Good. Chalo, it is possible. Then, large head. Very good. In Silicea, head is large. Good. 2 points. Beautiful. Anything else? Anything else? Now, just imagine the head. What could be the common problems that can come related to head? Common things. Very good, headache. Many times if somebody comes with headache, we tell we are very happy. At least आपको सर तो है ना, इसलिए दुख है. चलो, headache, good, headache. So anything else other than headache? Think. See, सर में क्या क्या आएगा? Scalp आएगा, fine. Hair भी आएगा, hair. And go back to the introductory class. Where do you see Silicea? कहाँ पे? Good. Other than nervous system, it is present in hair. So lack of Silicea can also give rise to hair fall. So what you need to understand is, the knowledge of anatomy, physiology will help us exploring head symptoms better. So there can be headache, only headache, hair fall, very good. Something you are missing in between. Focus on your scalp. What else? Good, dandruff, very good, no issues, good, dandruff, think. At least I'm happy you are focusing on your scalp. Okay, good sweating, possible, good sweating. One more small thing. Lice, no issues. Could be lice. I have asked you to focus on scalp and I am very happy you are focusing on scalp. बाजू के लड़के के देखे सर lice. Lice. Luckily you didn't look at my hair. Otherwise you would have told grey hair, no hair. With due respect. आया था सर मन में लेकिन कैसा बोलो? आप वहीवा में आएंगे ना तो मुश्किल हो जाएगा. So hair fall, what you also see in Silicea, I will be telling you a little later. It's very important. Pus. So many times there can be funsi, there can be eruptions on the scalp. And these eruptions can be pus filled. Okay. So quickly we have headache, we have eruptions, which is possible, and the worst thing you see here, what you see is, you see hair fall. Okay. So these are the possible things that can happen in Silicea head. Okay. So we'll quickly look at headache. What could be the cause for headache? Now, from where will you get this information? We have already discussed ailments from. Good. We have already discussed ailments from. The ailments I told you were general ailments. Now what are we trying to do? From general ailments, we are trying to pick up those ailments which can give rise to headache. Will vaccination give rise to headache? Possible, don't know. But generally, vaccination may not give rise to headache. So we are not putting vaccination here. So what ailments can give rise to headache in Silicea? Stress, very good. Exam stress. Doctor साहब मेरे को कल exams है and अभी सर दुख रहा. चलो possible. Then good. Nervous weakness, exam stress, anticipation, exposure to cold, very good. Good, I'm happy. Exposure to cold. Mental stress, ailments. नहीं, ailments मतलब cause ना. आप जो बोले वो result है. Okay. So ailments from, आप सुनो मैं फिर आ जाऊँगा. So ailments from mental stress, ailments from exam stress, overeating, and you told cold, exposure to cold weather, and ailments from, no, don't look at this image. Ailments from fasting. There is a plate, image may not be very clear. She is not eating anything, she is fasting. So a Silicea patient, when he or she is fasting, they land up with headache. समझ रहे क्या? They land up with headache. So these are all the ailments and location. What is this? Location. What is a complete symptom? Way back, I told you about complete symptoms. What is a complete symptom? A symptom? Location, good. Location, sensation, modality, concomitant. This is a beautiful example of complete symptom. We spoke of ailments, then we are looking at location. So just understand, see the beauty. Every person who has an headache will have a character. You are clear? Fine? And with due respect, in allopathy, any pain, any headache, other than the diagnosis, they give you a painkiller. But for a homeopath, this is the seriousness you youngsters should understand. This is how you are unique. This is how you are different. Fine? You focus where the pain is. And each of us have a different location. In Silicea, pain starts in the occiput. From the knowledge of anatomy, pain starts in the occiput behind. डॉक्टर साहब देखो इधर शुरू होता कहाँ इधर 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 शुरू होकर ऐसा जाता डॉक्टर साहब ऐसा जाके देखो डॉक्टर साहब इधर चले जाता कहाँ चले जाता आंख में चले जाता patients explaining like this. So what did you understand? What did you understand? In Silicea, pain starts in the occiput. Occiput से नीचे जा रहा है क्या? नहीं. कहाँ जा रहा है? Occiput से it is going up. अब जाके इधर रुक रहा है क्या? नहीं. और अब जा रहा है. और अब जा रहा है. फिर डाउन जा रहा है. डाउन जाके कहाँ जा रहा है? आंख. Left arm, right arm. Generally, Silicea is right side. Okay. So headache starts in the right occiput, goes up and settles over the right eye. Fine. What are we talking? We are talking of location. You should be very, very clear. Patients come like this. With my experience, I am trying to tell you. They come like this. And with my experience, when you give Silicea, the right remedy, headache vanishes. Headache vanishes. Okay, so remember, very important. Sensation, shaking sensation in the head when stepping hard. When he is stepping hard on something, there is a shaking sensation. What is the sensation? No. What is the sensation? What type of the symptom is sensation? What type of the symptom is sensation? What is sensation?
Kind of pain.
No. He is telling, sir, shaking sensation. Very good, beautiful. Subjective. I don't know who told, but beautiful. Subjective. Why subjective? Why subjective? Because are you feeling the shaking? Oh, no. It is not shaking. How nicely it is written in books. Shaking sensation in head. So the patient feels it is shaking. Are you really shaking? No. Are you able to see that is he shaking? No. He is not shaking. But he is feeling he is shaking. So what is this? This is a subjective symptom. Only patient will feel. Majority of the sensations are what patient feels. Doctor साहब मेरे को ऐसा लग रहा है कि मेरा सर फट जाएगा. Then don't go down and try. कहाँ फटेगा? चलो मैं भी एक पीस पकड़ूंगा. So सर फटेगा क्या? Nature, God has given us a beautiful anatomy. सर नहीं फटेगा. सर दर्द में तो 100% नहीं फटेगा. Fine? But patient को क्या लग रहा है? What is the patient feeling? इतना दर्द डॉक्टर साहब. क्या? इतना दर्द ऐसा लगेगा कि ये फट जाएगा. हाँ, हाथ पे जाएगा, पाँव पे, चलो फट जाएगा. So what is the sensation? As if head will burst. But is it happening in reality? But who is feeling? So this becomes a subjective symptom. Okay. So we'll go ahead. Sensation and what are we looking at? We are looking at location, sensation. We are looking at modality. When is it aggravating? I mean, see, workout you could have put a body, no? What is this that is getting worked out? Brain. So mental stress. जब भी मैं थोड़ा mentally stressed हो जाऊँगा ना, मेरा सर दर्द ज़्यादा हो जाएगा. So mental stress, studying, noise, okay, noise, walking, fine, cold. These are aggravating factors. And what ameliorates? There's something very precarious. जब सर दर्द होने डॉक्टर साहब, पेशाब गए ना, सर दर्द तंग, there will be no headache. Headache better by urination. Don't laugh. It can be MCQ question. During class you are laughing and it will come in the exam. Ayo, MCQ, 1 mark. Every question is important. Headache better by profuse urination. Okay. Ruta, arnica, ledam. None of the above. None of the above. Don't write Silicea and put tick. It is none of the above. Okay. So profuse urination, tying something tight. You know, for example, many of you, जब सर दर्द होता है तो रुमाल लेंगे आप, टाइट करेंगे, दुपट्टा लेंगे, you know, tying something tight, and pressure, warmth, urination. 3 things ameliorates headache in Silicea. What is the last component of complete symptom? Location, sensation, modality. What is a concomitant symptom? Very good, associated symptom. So in Silicea, yeah, headache which comes every 7 days. Every 7 days. We call it as periodical headaches. Headaches coming every 7 days. Headache associated with excess hair fall. Excess hair fall. And what is this image? Very good, baldness. Go ahead. Beautiful, good. First up, baldness. Beyond baldness, what do you see? Very good, good. Front, back, chalo. Good. What you also see is baldness in young people. Okay, he's young. I know, I have shown only half. Sir, मेरे को पूरा देखना था. फिर हम लोग बोलते थे कि कितना young है. Fine, चलो. So baldness in young. So what is the other word? Premature balding. And now it's a fashion. 25, 24, आधा चला गया. 23, 22, 26. Many weddings we see. And we feel bad. शादी का बाद इसका क्या होगा? शादी से पहले आगे चले गए. Fine. So like I mean balding, premature balding. Last part is eruptions. How will the eruptions be? Very good. Pustule, painful eruptions over scalp, painful pustule. And last somebody was talking here is sweating of scalp, which is offensive. Scalp sweating acrid नहीं रहता, ज़्यादा acrid रहता है soaps. Okay? Sweating offensive. These are the possibilities. We'll take up J or we'll stop. Yeah, class. So 5 minutes we'll try to finish this. Or any questions yet till now? Characteristic symptoms, some 8-10 I gave, and I started with particulars and we spoke of it. Headache, hair fall, balding, eruptions, sweating. And we are looking at a very important area, and this is GIT. Quickly, you know this, tell me, what do you expect under GIT? Very good. आप नीचे से start करो, आप उल्टा start करो, आप इधर से शुरू करो. See, I got nothing against constipation. लेकिन constipation कहाँ आता है? मुंह में आता है क्या? Rectum में आता है ना? So we have an order. And this is what helps you in writing your exams tomorrow. It will be systematic. Fine? So always start from mouth. GIT means mouth, throat, stomach, intestines, and of course the rectum. बीच में आपको liver है. अगर पैंक्रियास गिंक्रियास कुछ और है तो आप लोग डाल सकते हो. लेकिन मौत में क्या हो सकता है? Very good, ulcers. चाला, correct, very good, ulcers. Good. Ulcers. ಬಾಯಿಹುಣ್ಣು ಅಂತೀವಿ ಕನ್ನಡದಲ್ಲಿ. ಬಾಯಿಹುಣ್ಣು, ulcers. Good. Think now. What else? Good. What made you think of caries? Decaying. No, what made you think of decaying? What made you think of caries? It is a remedy acting on the fibrous tissue. It is a remedy acting on the bone. Somebody said periosteum. आपने बोला था ना periosteum. So remedy acting on the bone, and it can give rise to caries, dental caries, ulcers in the mouth. Good. Anything else? I'm happy. At least first year student, you are thinking so much. Good. Very good. Beautiful. Q offensive smell. Very good. Pyorrhea, offensive smell. Boys, are you with me? See, few of you answering. I don't want others to get disconnected. Please start thinking the way they are thinking, and it is possible. When they can, even you can. Just use your common sense. One of your friend is telling bad breath. Fine? The moment he comes, you will be using your hanky. Chalo, Silicea. Many remedies. So bad breath. One more key thing you are missing here is pus. Pus. So the gums can go into infection. Okay? Gums can go into infection. Now, this gum boil, pyorrhea, gum boil, or the gums getting infected, pyorrhea, that is what gives rise to bad breath. Ulcers, caries, these are few things. Okay. Now we did with the mouth. If you just go down here in the throat, very good. Tonsils. Why? What made you think of tonsils? What made you think of tonsils? Go back to the sphere of action. It is a remedy acting on the glands. Alas. So, what are tonsils from your anatomy knowledge? They are glands, lymph glands. So, Silicea, very good, affects glands. So, what will Silicea do acting on glands? Very good, hypertrophy, very good, good, beautiful. So the glands, I'm happy to hear the word, good. मैं इधर देख रहा था उधर सर hypertrophy मैं इधर चलो good. So the thyroid, the tonsils will get enlarged, good. Anything beyond that? Beautiful. Wherever there is possibility, pus डालो ना, suppuration. Suppuration बोलो ना, बिंदास बोलो. If it is required, I'll take it. नहीं तो इधर भी pus. चलो good. So tonsils can go into pus. We call it as quinsy बोलते हैं हम लोग. आप पढ़ो घर जाके quinsy, Quinsy. All these things you'll have to look into your books. Quinsy. So peritonsillar abscess. So what will happen when there is tonsillitis? What will happen? Beautiful, good common sense, sir. इतना hypertrophy है, इतना pus है, can you swallow? Doctor sir, pain. And one more thing, cold settles in throat. Cold settles in throat. They get exposed to cold air, throat gets affected. Tonsils gets enlarged. So tonsillitis, and now you are here, throat, I am coming down into the stomach. Stomach में क्या हो सकता है? चलो inflammation, gastritis, ulceration, and stomach is one area where you will be rating the desires and aversions. Okay, so now what are the desires of Silicea? Egg, very good. Cold things, ice creams, raw vegetables, very good. What are the aversions? Cooked, good, meat, mother's milk in infants. Salt. Okay, and wrong things. Garam अच्छा नहीं लगता उनको. Garam अच्छा नहीं लगता. So these are all the aversions which we will be rating under stomach. Okay. Now lower down. Yeah, sorry. I'm in a little hurry. Lower down means abdomen. What do you expect? Somebody was talking of bloating. When I told you Silicea child, bloating. So you see pot-bellied abdomen. Bloating of abdomen, pot-bellied abdomen, and in liver. And in liver, there can be pus. Very good. My asana, samjho pus. So pus. So there is something called as liver abscess. So Silicea can be a good remedy for liver abscess. Okay? Liver abscess. Fine? Now we will come to the last area which you are very keen to explore. What is that? Constipation, fissure, fistula, or pus can happen there also. What we call it as perianal abscess. Perianal abscess, you will have to look into your books as an assignment. Perianal abscess, fissure, fistula, constipation, hemorrhoids. Constipation, what is the character? Hard, nutty, dry. It has to be removed mechanically. Comes, goes. Okay. And there was a female image which was shown. Why was it shown? Constipation before and during menses. Okay. Good. That's the last slide for you. Yeah. Good. Very good. So fissure, very painful, great straining, feces remain long in rectum. So these are the few things you need to remember. Now before I close, I'll take up the skin in the next class. Okay, now, anyway, there are a lot of things. We'll do it in the next class. Okay, next Monday, next Thursday, I'll continue. Okay, now before I close today's class, a quick recap. What did we do? We spoke of characteristic symptoms and we started with particular symptoms. We spoke of head and immediately I skipped few things. You did not ask. I told you anatomical order, but head ke baad immediately JAT. Because there were few things in between which will be given to you as an assignment. That we'll look into the assignment part in the next class. So head I told you in detail and then we discussed the GAT, very important. Okay. Next class we'll look at the skin, modalities, Silicea child and the assignment part. Okay. Any quick questions? Boys, behind? Girls? Any questions? Sir? Huh?
Feeding is